Are you thinking of getting pregnant or you are thinking to have a baby? Then this video is for you. I will be telling you the required pre-pregnancy blood tests that you should go through in order to have a safe pregnancy. So let's begin our video. The first test is full blood count test, in which the hemoglobin levels are checked. If your hemoglobin is less than the normal, then it would be harmful for the baby. So in order to improve your hemoglobin, you need to have some iron supplements or iron rich food. Next is the hepatitis B test. If you have not taken any hepatitis injections or vaccines in your life, then go and give a shot to it. Otherwise, it may lead to liver damage in your future kid. So it's important for you to have a hepatitis B test, identify if you are required the required vaccine, go ahead and have it. The next test is the HIV test, the most important test. It should be happened before you are trying to conceive. If you are having HIV, then there may be chances that it may be transferred to your baby. So it's important for you to know it beforehand and to get the required medication in order to stop the virus going to the baby. Next is thyroid profile test, in which TSH hormone is being identified. If your thyroid hormone is less produced in your body, then it may lead to infertility or may cause miscarriage. So it's important to know your thyroid levels. If you have less thyroid, you should consult the gynae and she will provide you some required medicines. Next is blood group test, in which your blood group is checked and the antibodies are checked. Because some antibodies may defer pregnancy, so it's important to know those antibodies. Apart from that, rhesus test is being done in order to identify which particular antibodies are harmful. The next is varicella zoster IgG test. It also being done in order to identify the antibodies or virus that can cause damage in your pregnancy. Thalassemia screening test is done mostly in abundance nowadays before pregnancy in order to identify if you have a sickle cell or not. If you have it, it may be passed to your genes or it may cause some problem in your pregnancy. Next is the diabetes test, in which fasting and post-lunch test is being done in order to identify you have diabetes or not. If you have the diabetes, then it may have some birth defects in the kid. Next test is the rubella test. It's done to identify German measles virus. It's important to identify this virus. If they're in your body, it may cause deafness in your kid, it may cause brain injury, or it may cause miscarriage. So rubella test is another important test that need to be done before getting pregnant. So these tests and vaccines should be done 1 month before you are trying to conceive, because these antibodies need time to adjust within your body. I will suggest you to go to a gynae if you are thinking to conceive and let her examine you and let her note down the required tests that are required for you as per your body needs. Some may have less test requirements, some people have more test requirements. So it's not an ideal step bar that you have to go through all these tests. So first you consult the gynae and know whether you have to go through these tests or not. So this is all that I had in this topic. If you have any query, you can ask me at the comment section. And if you like my video, like the information, please do share and subscribe to my channel, Mom's Guidebook.